Dizziness is something that many will experience throughout their life, but for many, it can also be very debilitating. What we're going to cover today is 5 causes of dizziness. Before we dive into those 5 causes, we're first going to dissect what actually happens in the brain to cause dizziness. Because the better you understand this, the easier it's going to be to understand why something can cause dizziness, because we've got obvious things that people think of for dizziness, but then we also have other things that are actually pretty common that we just don't think about because we're not thinking about dizziness the right way. So when we look at dizziness from a brain-based perspective, when you have dizziness, most people think about their inner ear and those ear crystals, okay? That's very short-sighted. While it can definitely be a cause of dizziness or vertigo, which let's not use those interchangeably because they are very different. But your inner ear, right, would be in here a little bit. But when we look at that, that is your vestibular system, okay? That is the peripheral part, whereas the central part of your vestibular system is going to be right here, okay? So cranial nerve number 8, it's going to be right in the middle of your brain stem. So if you think about your brain, you've got your tree trunk, and then you've got all the branches, leaves up top. So your vestibular system responds to that. Now, your vestibular system will feed information into your cerebellum, which is going to control and then send stuff back to the vestibular system to say, hey, you know what, you're overfiring. Let's feed back and get things right. There's a lot of information, though, that gets fed into your vestibular system, your cerebellar system. It's not just from the way you interact with gravity. So, for example, if you're going up and down on an elevator, escalators, other things like that, that is very much purely vestibular input because you are responding to gravity. But you also have other things coming in here because when we look at balance, it's gravitational, vestibular system. It's also how is your vision? Okay. So you have a lot of eye move. Your eyes are controlled very heavily in here, a lot of integration centers, but also other parts of the brain are responsible for your eyes as well. So your eyes have to feed in. Also, you get a lot of information that comes up here that's from your joints and your muscles in your neck. Okay. So cervical spine. So for example, if doing this or this makes someone dizzy, it's usually due to poor information coming in from their cervical spine, okay, their vestibular system, and even their eyes a lot of the time. And when the brain gets bad information and it can't control it, the outcome ultimately is dizziness. So I hope that helps you understand dizziness a little bit better from the brain-based perspective. Once again, more simplistically, your brain has to respond to gravity. It takes in information from what you see in the visual world and also takes in what you feel from a neck stretch, muscle response, and also joints are going to be sent to the brain. And when all that information lines up, someone can function in normal day-to-day life and they're not going to be dizzy. But if it doesn't line up, the brain says, okay, here's my perception, and that's going to be my reality. So now let's go into 5 causes of dizziness. First, let's just start off with very, very simple and basic. Blood sugar. If your blood sugar is off, it can create dizziness. Now, for a lot of people, this is going to be when their blood sugar is too low, so less than 70. There are people that can even go lower than that before they finally get dizziness. Now, on the other side, having elevated blood sugar can also give someone dizziness. Depending on where you're at, we can see this in a lot of diabetics or people that are having, temporary, just really high spikes. So that can definitely cause it. 2, blood pressure can also cause dizziness. Now, you can get dizziness from your blood pressure being too high, but once you've also been treated for blood pressure, if you are using medications, you can get dizziness if your blood pressure is too low. Now, for a lot of people, that threshold is about a systolic number. So like whenever they say like 120/80, 120 is your systolic. That can be 90 or even 80 is when a lot of people will start feeling dizziness as a result of that. Now, let's go into Concussions. Concussions are actually a very common cause of dizziness. Each year, 6-7 million concussions occur in the United States alone. And when you have a concussion injury, you get damage and disruption in the way your brain is communicating and connecting. Now, one thing that happens with many concussions because of the movement of your brain within your skull is you get rotary and almost like twisting of your brainstem. And as we've talked about, your vestibular system is here, it has feed into your cerebellum to coordinate stuff that can routinely be damaged with a concussion. So dizziness as a result of a concussion is actually very common. And then I'm just going to lump in there with concussion also whiplash injuries, because whiplash injuries are very commonly occur in car accidents as well as concussions. The only difference is you're more likely to be diagnosed with a whiplash, and the concussion diagnosis, even though it should be given, is often missed. So if you're dealing with dizziness from a car accident or other things like that, where you had a rapid motion, case side to side, forward and back, if you were told you have whiplash and you're still not getting better, don't exclude the fact that maybe there was actually a concussion that needs to be addressed as well, because the treatment is going to be different for one versus the other. Whiplash is focusing much more on the neck, whereas concussion has to focus a bit more on the integration of everything we've talked about, but also going after immune changes and other things like that within the brain. So once again, those are three, right? Blood sugar, blood pressure, concussion / whiplash injury. Number 4, infections can also cause dizziness. Acute infections are very well known to cause dizziness, whether it's from flu, meningitis, okay, COVID, other things like that can definitely cause it, especially if you get it and you start getting rotational dizziness, which rotational would be vertigo, but let's just use dizziness because we've said it's rotational. That is also a cause. Different treatment needs to be done for that as well. And lastly, number 5, this is something that I've seen about 5%, maybe even 10% of my concussion patients that don't respond in the way I think they should. And they usually have a lot of symptoms from fatigue to brain fog to joint pain. Sometimes they've got weird movements that you're just like, look, that's not making a lot of sense. We're finding issues. And while their eye movements and their balance looks very much like a concussion, it ultimately is a concussion, but that's not the whole story. And this can be due to biotoxins. Okay, when we say biotoxins, these are toxins released from living organisms. So we've got mold toxins, we've got endotoxins, we've got actinobacteria. That's actually more common than mold for causing dizziness. Lyme disease, other things like that can definitely cause it, especially if you've done all what would be considered the basics and you've had everything else rolled out. You know, it's okay to go to that next level, and just usually don't go there from the very beginning unless the history and everything tells us that's where we should go. All right, so I know we've covered a lot. Once again, dizziness is an issue where the brain doesn't take in the information right and ultimately leads to dizziness. Dizziness can be disrupted as a result of a concussion, a whiplash injury, but also it's not just about injuries to the brain directly, but there are other things that can impact how the brain's connecting, from blood sugar to blood pressure to infections and even biotoxin illness. Hope you found this useful. Comment, let me know. What did you learn? What do you have questions about? And I will use that in making other videos moving forward. And if you'd like to work with me, you can always check me out at idahobrainandbody.com. And until next time, this is Dr. Z.